Hello, and welcome to this online offering of SBAR reporting and bedside handoff for clinical staff. My name is Mike Finch. I'm a registered nurse in hospital education, and I'll be your narrator for this period of instruction. Before we delve into the material of the class, let's talk about the objectives real fast. At the completion of this module, you'll be able to understand the medical center policy concerning SBAR communication, define each part of SBAR and what it means, understand the benefits of using SBAR for communication, know when SBAR needs to be used for communication, define what bedside report is, and understand the benefits of bedside reporting. Medical Center Policy 6019.509, Handoff Communication, SBAR, is the policy that establishes SBAR as the process that will be utilized to receive or share patient information related to treatment and services for both internal and external providers. Please ensure that you read this policy and understand it. If you have any questions, reach out to your nurse manager or supervisor for clarification. The first part of SBAR is situation. This component should take about 8 to 12 seconds, and you'll be stating what's happening now. If you're giving a shift report to the next caregiver, you'd be stating the patient's name, why they were admitted, why they're on the unit, and introduce that oncoming nurse to the patient and their family. Make sure that you are effective in your communication and be clear and concise and to the point. Leave any irrelevant information out of the conversation. Next is background. During background, you'd be giving the next caregiver a brief background information specific to the patient's relevant medical or surgical history. This is setting the context for what's being discussed, which may include things like the patient's diagnosis, history of procedures done, and the family situation. Third is assessment. During this component, you'll be reporting the current condition of the patient. For example, what their blood glucose is, what their vital signs are, how they've been ambulating, what their pain is. The final part of SBAR is recommendations. During this component, you'd be stating things that would be desired for that patient's care at that next shift. It may be things such as discharge planning, a mobility plan. Hey, they'd like to get out of bed at least twice and walk. It could be pending procedures, return to OR, return to cath lab. It may be something about advancing the diet or getting a central line removed. Remember though, not everything about a patient needs to be conveyed in SBAR. Just what is pertinent to the situation at the time. And remember, effective communication takes two. If someone is providing an SBAR report to you, ask questions if you have any. And if you're giving an SBAR report, be sure to ask if they have a question from you. Currently, there are 3 approved SBAR tools for use at Charlie Norwood VA Medical Center. These tools provide an easy way to document necessary information in an easy-to-use format. These templates are organized by the area they are used. One template is for mental health and DOM, one template is for the CLC and rehab, and the final template is for the acute care areas and SCI. Please remember, this SBAR tool is not a part of the patient's permanent record and is to be properly disposed of upon discharge. The SBAR format can also be used in more emergent situations, such as this example. If I was calling a physician about a patient, right when I get him on the phone, it would go something like this. Dr. Smith, this is Mike. I'm a registered nurse on MedSurg, and I'm calling about your patient, Jane Doe. Situation. Ms. Doe is having increased dyspnea and is complaining of chest pain. Background. She had a total knee replacement 2 days ago, and about 15 minutes ago, she began complaining of chest pain. Her pulse is 120. Her blood pressure is 128 over 54. She is restless and short of breath. Assessment. I believe she may be having a cardiac event or a pulmonary embolism. Recommendation. I recommend that you see her immediately and that we start her on O2 stat. Do you agree? Some of the benefits of using SBAR are it is a clear, concise, standardized format for all reports or handoffs. It's a format that's recognized and accepted across the caregiver spectrum, meaning physicians understand it, respiratory understands it, nurses understand it, nurse assistants understand it, health techs understand it. And it allows transfer of critical information rapidly. So when does this SBAR reporting format need to be used? Per the medical center policy, it has to be used for the following: at end of shift reports or shift changes, anytime clinical staff provide coverage for another team member for a short time, such as breaks, meals, classes, or meetings, when relinquishing or assuming patient care and responsibility, when admitting a patient to a patient care area, when transferring in or out of any clinic, unit, or department with Charlie Norwood VA Medical Center, transferring of patients following any procedure or operation, inter-facility transfers, ambulance transfers, or transfers outside of the hospital, skilled nursing facilities, or other long-term personal care facilities. If you have questions with these, again, please ask your nurse manager or supervisor for clarification. What is bedside reporting? It's exactly what it sounds like. When it's change of shift, the report between the offgoing and the oncoming nurse happens at the patient's bedside, physically in the room at the bedside. This allows not only there to be good communication between the two nurses, but communication with the patient and any additional family members or close friends that the patient has identified in report. So how does bedside reporting benefit our patients? Well, by listening to report, the patient learns about that plan of care and the goal for the day. It acknowledges the patient and provides a feeling of inclusion with the nurses as part of the healthcare team, while providing reassurance to the patient that the nurses work as a team. It reinforces that nursing staff are getting all the information needed to facilitate care, which helps decrease patient family anxiety and helps improve patient satisfaction. And it gives the patient and family opportunities to ask questions or correct any information. You want to start discussing the bedside report process with the patient upon admission to the unit. The patient can choose whether family, a significant other, or a friend can be present during the bedside report, and those wishes should be passed on to the next nurse. Now that we've discussed how bedside reporting is beneficial to patients, let's discuss how bedside reporting is beneficial to staff. It allows you to put your eyes on the patient during shift change, not an hour later. It gives you the ability to check those things like fluids, medications, tubing expiration, the overall cleanliness of the room. Has the Foley bag been emptied before the offgoing RN leaves? It provides an efficient report which streamlines all the pertinent information, saving time. It improves staff teamwork by giving nurses the opportunity to work together at the bedside, ensuring accountability. It uses, of course, that standardized format to reduce the risk of miscommunication. And nurses are always on the same page for report because they're both looking at the same information in the same patient. And let's be honest, all of us have had one of those where you talk to the patient later and they say, well, the earlier nurse said I could do this. Having that bedside report eliminates that because they know exactly what was passed on, and the patient and family were a part of that report. So, in wrap up, the utilization of both SBAR and bedside reporting not only increases safety, but it also increases patient and family satisfaction. It assists the staff by having a single reporting format, so important information is shared, and it empowers the patient and the family to take active part in their care. If you have any questions, comments, or concerns, you can shoot me an email, or you can ask your nurse manager or supervisor for more clarification.